Welcome to the office. Hi! How's it going?
Good.
What's your name?
Dylan.
Dylan, nice to meet you. I'm Dr. Rahim. Dad?
Hi, Lon. Nice to meet
Lon,
you.
nice to meet you too. So tell me, what brings you guys into the office?
The reason why I brought Dylan in here is because I noticed that when he's running, his gait is off a little bit.
Okay.
We believe that maybe some of the reasons why is because when he's playing soccer one time, he was trying to kick the ball and he fell on his bottom.
Kate, are you right-footed, left-footed?
Usually more right-footed.
And you said, so when you noted he was kicking, he had a fall or he was off balance?
I think he was off balance. I wasn't there that day, but all I was told is that he fell on his back.
When was this?
I think it's been a couple of years now.
A couple of years.
Yeah.
And since then, what's happened?
I noticed that he can't really kick that high. He has trouble trying to do that, and when we try to do exercises with him, he has, he struggles a little bit.
What do you want to do better?
I would like to touch my foot because usually in PE I wouldn't be able to touch my foot like my friends.
Okay, it hurts your back to touch your feet?
Yeah.
Can you show me what you're talking about? Can you
Like
stand
if
up?
I did this,
Yeah.
does it work?
And does it hurt somewhere when you do that?
If I go farther, it does.
Where does it hurt?
It
It hurts back here in your back?
Yeah.
Does it hurt at the lower back or it hurts a little higher?
And it hurts like right here.
Okay, so where he's pointing at, do you mind if I just open this up a little bit, please, so we can see? So this is his sacrum here, okay? His sacrum is here, and he's complaining of right around L5 sacrum area. More on the right side, more on the left side, or in the center?
More on the right.
More on the right side. Okay, have a seat, please.
And I have one more question.
Yes, what is it? Talk to me.
When you help me, will it sting or?
I don't know. It's not a matter of sting. You may feel nothing. It may be a little spicy, like you had a little bit of black pepper or something. You ever eat a spicy chili in the food by accident?
I think I have in noodles.
You've had a little chili every once in a while, right? And it's spicy for a little bit, but then it goes away, right? Yeah, it's kind of the same thing. Maybe. I don't know until I examine you. But I will ask for your permission before I adjust you, okay? Deal? Cool. Let's go over the x-rays. Let's see what we find. Now, you're kind of in between. I have a baby spine, but you're not a baby. This is what our spine starts like. Okay? But that's not you. You're in between this and this. This is a full-grown adult spine. Now, for 10 years old, your body is still forming. Dad, he has growth plates, growth centers, and these are still forming. And if we have alignment issues, and it can be affecting the growth centers, then what happens during development, they could grow a little bit different than what they should.
Yeah.
Okay, that's what we're going to go over. And we're going to go over this one first, and we're going to look, I'm going to zoom in on his foundation. We can see there's a little bit of a curvature issue here, right?
Right.
You can see there's a little curvature issues, and he's getting a little, it's starting here, then it's going this way, and it's going that way.
Right.
But the question is, let's look at the foundation and see what's happening. Let's zoom in. And let's talk about it. And you can actually see his growth plates still. You see the growth plates here. You can see the growth plates here. You can see the growth plates here. You can actually see the growth plates here that the iliums haven't fully fused, right? But can you see the difference between this side here and that side there?
Yeah. One's
Right.
higher than the other.
One's higher than the other. Can you see how this growth plate is forming here?
Yeah.
And how is this one forming? It's a little bit different.
Yeah.
You see that, yes? You see there's a little bit something going on in this bone here. You can see a little slight lucency there. This side is okay. Right?
Yep.
So something did happen on his left side. Something looks off actually on his left side. Let's look at the shapes. Now, the shape of the bone is telling us how the alignment is. You see how this side looks thicker, this side looks thinner?
Yeah.
You see how this side looks a little bit higher, this side looks a little bit lower? So let's look at the numbers and let's see what they mean. And there you go. Now this makes a lot of sense. Okay, so he's got a few things going on here. We have an AS2 IN12. We have a severely rotated left pelvis. We also have a left sacrum issue. We have a drop sacrum on the left, so he has that sacrum that he fell on. And this, I'm going to put it together for you in a second. We have a measured difference of 5 millimeters. If I correct the pelvis first, I'm going to make the leg worse. So the answer is not in his pelvis. Okay? We will have to address that at a later time.
Okay.
The answer right now is we got to get this sacrum forward and up.
Okay.
That's number one. If I adjust ASIN, look, it's up and in. If I bring it down and out, it's going to make this go down even more. So we have to first stabilize the sacrum and get that up as much as we can. He's young. Should, depending on how he adjusts, we should be able to do it in a little bit, not this lengthy period. And then from there we re-x-ray him, see what changes, and then decide on the next course of action.
Okay.
Okay? That's kind of the way I see it with
Okay.
him. All the other stuff above is all secondary. This is a foundation case. This is a fantastic example too. And just like you saw the boy who had that soccer injury, tailbone, who threw off his growth centers, who threw off his ankle, he fractured his tibia. The tibia healed beautifully, but all those alignment issues were there.
Yeah.
And you know, Dad did a great job by bringing you in, so hopefully we can change this, you know, from things from getting a little out of hand down the road.
Yeah.
Okay. Dad, does that make sense?
Yes, makes sense.
Dylan?
Not
Let
really.
me show you. So this is what's happening. This is your left side. This is your tailbone. So I'm talking about your left pelvis. Your left side goes up and it turns in this way. Your sacrum, your tailbone goes like this and it goes down. So the overall effect is he wants to go to the right side. And that dropped hip is what's causing this curvature, slight curvature issue that he's having. So it's getting a slight curvature to the left, and then it's trying to come back to neutral. But here's what's kind of getting me right now. This, whatever happened, definitely affected. This is different from this, these growth plates, these growth centers. So it's almost like we need to take this tailbone and we need to bring it up. Okay? And it's not, it may be a little tiny spicy for just an itty bitty second. Maybe. Okay? So we talk about those tailbone injuries and falls and nubs. And his overall effect is pretty decent overall. But there's something a little bit off. It's very subtle. S1, S2, it's S3. S3 is slightly open in the back and slightly forward on the bottom. So it's doing this. It's just tilted like that. So that's probably the one, S3, maybe even S4, okay? It's very light, it's very subtle. Do you see what I'm showing you, the piece? This one is fine. This one is open in the back. This one is this is open in the front, but it's slightly tilted. But we still have this beautiful smooth appearance, just a little bit there. Okay, let's get started. Okay, so you can see this dimple is lower, this dimple is higher. You can see how he curves to this side. Okay, and go ahead and walk towards the corner, please. Just regular walking. Is that how you walk? Swing your arms, just walk normal. Come here and give me a high five. Give me a high five. Cool. Can you go over there and tap your sweatshirt? Is that how he walks then? Side to side?
Yeah.
Okay, come over here, come back. Turn around. Dad, you want to go on that side so he can high five you?
Okay, sure.
Yeah, that'll be better. That way he's got a target.
Okay.
Go ahead and high five Dad. Come over here and high five me. Good job. One more time to Dad. Alright, so what's happening here? Come over here and have a seat. Perfect. So here's what's happening. He's walking like this. There's no movement through his SI joints. So instead of getting this motion this way, he's just going side to side like this. That's what we need to correct today. Okay? Let's go ahead and run the meter on his back and let's see what we find. And let's go ahead and see what we have. Head down, please, Dylan. Head down. Good. And we're getting pressure C1 up top, left side. T7, left side. All of this is coming from down level. There it is, Dad. Am I tickling you?
No, it now gets hurt. It hurts.
It hurts down here? Okay. S3, left side. Okay, let's take a look. Now, let's go ahead and palpate. You can see this, Dad, this is swelling.
Yeah.
Okay, this is the tailbone injury. Back slowly towards me, slowly. That's number 5. Does that hurt?
Not really.
How about S1?
Kind of.
How about S2?
A lot.
A lot. How about S3?
Ow.
Yeah, S3. So S3 is what we're seeing. Scoot back for me, please, Dylan. Now with Dylan, we're going to need to be quick. We're going to need to be light and quick. 4, 5, 6, 7. Tender when I push there. Does that hurt?
Yes.
Can you uncross your legs, please? Thank you. Does it hurt more when I push here or here?
There.
7. T7. S3. 4, 3, 2. Does that hurt when I push there on the left?
Yeah.
Does that hurt when I push on the right?
Not really.
Good job. Look straight, turn left, turn right. Did you guys fly or drive?
Right.
Yeah, he's tight on that right side. C1, T7, left, S3. So we're going to start on S3. We're going to do S3. We're going to need to torque it up to get that sacrum up on that left side. PL, P2-L, S3 with a little bit of torque. How's that? Sounds kind of fancy, huh?
Kind of.
Yeah. You ready for me? Shall we get started?
Yes.
Okay. Right there. And we're going to actually do this as a push. Push-pull. We want to torque up this way. Nice and easy. Nice and easy. Come forward. Gotcha. That's the home run, Bella. Did that hurt?
A little.
A little bit? A little spicy? Okay, stand up for me, please. Let's walk. And I'm going to open your gown in just a second. You keep walking. Before I open the back of your gown, keep walking. And why don't you tell us if anything feels different right now?
Well, somewhere. Feels a little different.
Okay, keep walking. Good. Keep walking. Come over here, turn around. And let's see. Let's see what happened. Well, what do you know? All right, go ahead and walk over there, please. Walk. Hey, Dad.
Yeah. I noticed it a little bit, yeah.
They're moving up and down now. Good stuff. Keep walking. Pretty cool. Come back over here, have a seat. Let's retest. Back slowly towards me. This is number 5. Do you remember this? This is S1. Does that hurt?
No.
This is the one, S2. Does that feel different? Does that hurt?
No.
This is S3. Does that hurt?
A little.
And S2?
No.
Pretty cool, Dad. Pretty cool. You ready for more?
Okay.
Come on.
Can I take off my mask?
It's
Yeah, go
okay.
ahead.
Is it okay with Dad?
Yeah.
Okay, you can take it off. There you go. You ready?
Yeah.
1, 2, 3, 4, 6, 7. T7, nice and light.
Oh.
Nice. That's the home run. Gotcha. And let's walk. Walk fast now. Check it out. Uh-huh.
I noticed that I'm walking a little bit faster.
That's right.
That's one of the problems. He walk and run a little slower than the others.
Well, I think we got some power on. Boom. Yeah, he's smiling. Keep going. Now we got to do the penthouse. You ready for the penthouse? I have to do the neck now, okay? It's light also. Relax there. Is that okay on your chest? Okay. Can I have you uncross your legs? There you go. And this one's going to be nice and light. Come here. Hi. We're doing a C1. Nice and easy. Left ear down. Just like that. Home run. A little spicy?
Yeah.
All good now? Stand up and walk it off.
The neck feels a little weird.
Feels a little weird? Let's walk several times, okay? Feels a little weird how?
Like the neck. It just.
The adjustment or after the adjustment?
After the adjustment.
Okay, can you walk some more for me then? Walk several times and let me tell you what's going to happen. You've been used to being tilted for a little bit, okay? Now I'm straightening you up. I'm straightening out your spine. And we're getting the pressure off, so it should be a lot easier now to move. And while you're here, Dad, make sure you take him out, go to the beach, go to the park, just walk, be a kid.
Okay.
Okay? Is that a little different now?
Yes.
Can you touch your toes?
Well, I can't touch my toes all the way.
But does it feel better on your back when you go down?
Yeah.
It does, right?
Yeah. Because before I felt like my back was like pulling me back.
And now when you do it?
And I don't really feel it at all.
Good stuff. Have a seat. Now you get a buff and polish. All right, Pops, you can help out. Come over on this side, please. Hold firm here.
Okay.
I'm setting his ankle. Are you ticklish?
Yeah.
Are you a little ticklish? Hold him.
Oh.
Spicy. Ooh. Fourth, metatarsal base. Stand up and walk it off. Good stuff. As you're walking, I want you to tell Dad what's different, not me.
Now my foot's feeling different.
Is it better?
Yeah.
It's good.
My foot feels like it's able to move a little bit more. Yeah.
A little bit better, right?
Yeah, before I feel like my foot wasn't like it was a little stiff, but I didn't really notice that.
Feels easier, right?
Yeah, I just remember.
Come over here, squeeze my hand. Squeeze hard. Squeeze hard. Squeeze hard. Relax there. A little bit on your elbow. A little bit on your elbow. That's it. You have any questions for me?
Not really.
Welcome to the office. Nice to meet you. Dad,
Yes.
welcome.
Welcome.
Okay, any questions for me?
Not at this point in time.
Okay, so we're clear on what we're doing.
Yes.
All right, guys?
Did it hurt, Dylan?
No.
Yeah.
Tell them, did it hurt?
No.
Didn't hurt, right?
Yeah.
That's what I noticed from the video. None of the kids went home crying.
But you see my adults crying. You see my adults screaming, right? That's not me.
Yeah.
That's them trying to let out that stuff.
Yeah.
And sometimes it's a little spicy, but I don't think it was too spicy for you today. I think you did very, very, very well. I'm very proud of you. Bump it.
And I'm glad I brought him in sooner than when he's like 20 years old.
Okay.
Yeah.
All right, Dad.
All right.
Nice to see you. This is visit number 2.
Yeah.
And Dylan came in for some tailbone issue.
That's correct.
And this is from a soccer injury.
That's correct.
And this happened when, Dad?
I believe this happened about maybe a year or two ago.
Year or two ago,
Yeah.
playing soccer.
Yeah.
And we had one adjustment yesterday. Did you notice a difference in Dylan's gait?
Immediately.
Immediately.
I noticed a significant improvement already. Just
Awesome.
when their first visit.
Awesome. And what about you, Dylan?
Yesterday, everything was great. Like I was able to move more. I was less stiff, and I just felt a little better.
Okay.
But The only problem was my left ankle started hurting.
Was it sore?
Yeah, kind of.
Okay, well, we'll take a look at it and we'll continue on. Sound good?
Yes.
All right, you ready?
Yep,
Let's
ready.
do this. Okay, so what I want us to see is from his tailbone injury, he also has a rotated pelvis. We can see the ilium width is wider here, smaller here, or more narrow. This presents as an IN ilium, but it's tilted on this side. When we look at the growth plates here, the growth plates look like they're a little bit different here and also here. This looks a little more symmetrical. This looks a little tilted down. So what's a consequence of something like that is as the growth plates are forming and the bones are developing and maturing, if they're not aligned as they should be, what happens? They grow a little different.
Right.
Okay. Let's go to the side profile and talk about the tailbone here, and it's very subtle. And you know, as we've talked about, the sacrum is designed to be smooth through here. It can have a few little variations, but what we saw here was S2, S3, and a little bit of S2 we can see is tilted. This is fine here. This is open at the back. So this whole third tubercle is tilted back, and the fourth actually goes with it. And so we started on Dylan's S3 yesterday, okay? And I'm pretty sure that's where we're going to continue. I want to go to the numbers and talk about this briefly. So Mom, I know Mom is curious because Mom's not here. She's downstairs with the other kids. So Mom, this is what's happening. He has a rotated sacrum on the left, 2 millimeters. It's dropped down 3 on that side, and he has an ASIN. So the left pelvis goes up and in, meaning it goes internal. The sacrum on that side goes back and down. And then he has a measured difference of 5. Right now that's under 7 millimeters, so we're good. There's no intervention there. If I work on his pelvis, or if he was to just get some side pelvic adjusting without the proper analysis, this is very important, this gets worse. So the fix is not in his pelvis, even though he has the rotation there. The fix right now is the sacrum. We will then re-x-ray him after a certain number of visits. We will see what the difference is. I have a video I put up of an older gentleman. People have been following his journey. And we re-x-rayed him after 4 visits for something else, but the x-ray tech ended up doing the whole spine again. And immediately the sacrum changed, the leg length discrepancy, everything changed. And this guy is in his late 50s, early 60s. So it's to say that when the foundation is off and there's pressure, it can affect everything, but also there are things that are correctable. Okay? Okay. Let's get started. And the first thing I want to see is the swelling in here, and we can see the dimples. We can see this one is lower, this one is higher. Okay, the swelling is down. It is still there, but it is down, so that's good. Today we got 5 points up top. We had pressure in his mid-back yesterday. That is clear. And today we have 4 points.
It hurts a little, like, somewhere.
Right up in here?
Like that,
yeah,
or something.
Right there. So we have 4 points down in the sacrum. We have 5 points up in the atlas. So we're down in the basement and the penthouse today. All right, Dylan? Come back slowly towards me. Back. That's 5. That's S1. That's S2. Little tender. Does that one hurt more there or that one there?
That one.
That one there. Okay. Guess what, Dad? We're at 2.
So the 3 shifted to 2?
3 shifted to 2. 3 is good.
Yeah.
Very cool. Check this out one more time, please. All the way back, all the way back. That's 2. That tickles.
I'm trying to not feel the pain.
Okay, S2. Okay, sir. Let's continue on your S2. We're going to set this as a rotated sacrum, PL. We're going to do it right side down, and we're going to torque it up to get the sacrum up. Okay, Dylan. I think it's time for the cobra today, Dylan. Dylan gonna get the Cobra today. Nice and easy there. So we're on S2, slightly to the left here. We're torquing up. We're coming through the joint and torquing up. Hi. Shh. There you go. That's a little bit, a little more. Gotcha. Not so bad. Come up slowly, please. But we still got a little more. Let's go right over here, Dylan. The number one compliment we were taught to give the doctor or the chiropractor is a referral. But deeper than that is bringing your child, and I appreciate, you're entrusting your child to the work, and I really appreciate that.
Yeah, you did good work.
S2. Okay. You got him, Dad? We don't want him flying out the room, okay? Nice and easy. We're going to torque up this way. Gotcha. That's it. That's it. That's the worst of it, okay, Dylan? I had to go a little deeper, sorry. Dad, hold on to that. I had to go a little deeper today. Hold my hand, please. But guess what? There's still one more. Let's go left side down. You know Dr. Rahim isn't happy unless he gets the home run, right? Base hits are good. We need base hits. We had 2 base hits. I need a home run, though. So what I'm doing here is I'm on the bottom side, still a PL sacrum. I'm on the bottom side here, knife edge contact, and I'm going to relax your bottom leg, please. Let the bottom leg just relax there, please, Dylan. Perfect. And I'm going to actually do it involved side down and torque this way. Hi. Hi. You okay there on the shoulder? There's the rest. That's the home run. Come on up, Dylan. Hold my hands. Let's march in place. Okay, let's walk it off, please. I needed that home run for you, sir. Was that better, that last one?
A tiny bit.
A tiny bit? Okay, let's walk. Come over here now, and let's do the neck. Left ear down. There we go. Gotcha. Home run. There you go. Okay, let's walk that off, please. And let's take a look so we have something. Aha! There we go. Let's walk it off one more time. Dimples are going up and down, Dad.
Yep.
Walk on your toes, please.
Up
on tippy toes. Tippy toes. Excellent. Walk on your heels. Bump it. Yeah, let's go on your back. I'm going to use the board for your ankles today. And there you go. Sit up and turn, please. Go on your back. I want to do a little bit on your ankle. 5, 4, 3, 2, 1. 5, 4, 3, 2. Walk it off last time, please. As you're walking, ankles less sore?
yeah.
Good. So your homework is lots of walking, lots of playtime. You got a trampoline?
No.
Okay, squeeze. Some grass? You have grass at home?
Yeah.
You have grass in your yard, right?
Yeah.
Okay, so can you do this? Can you walk barefoot in the grass for like 15, 20 minutes every day? Yeah. Squeeze. Squeeze. You take care. Dad?
Yeah.
Thank you.
You're welcome. Pleasure. You're 18 years old with this back pain. Doesn't make sense to me, okay?
Yeah.
Hopefully it doesn't make sense to you either. Let's get an overall presentation of his posture. Take a step forward, please. And let's just look at some of the things we see here. So we're looking at symmetry. You can see it is puffy here around L4, L5. Down low, I can see the dimples decent. I can see this dimple more than this side. I can see he's kind of twisting as well. It's going like this. There's a kink in here, and then it shoots off to the right side. Right side is more pronounced, coming back. When we look at the sides here, you can see this too. These lines are different. We want that symmetrical V. Okay, so we can see slight imbalance. We can see the pelvis is off. Look, I'm just going to put my hands like this, and you can see it's doing this. It's going this way. Correct? Does that feel about right?
Yeah.
Yeah. Okay, so we'll evaluate the gait in a second. Let's follow this up. It is more pronounced here. Looking at the inferior angles, they're decent, maybe slightly higher on the right, but not so significant. The main thing I'm seeing is this, guys. I have to open this up because I want to show this, the handles on the side. You can see this handle looks more here than here. Let's take another step forward, please. Okay, you can see this here and this here. It's like, this is his body, like this. Okay? I'll make fun of you later.
Great.
Okay. When we're looking at the dimples here, we want to see good movement through the dimples this way, okay? I don't really see that movement. Let's watch here. Walk slowly away from us, please. So it rides up high on that right side. This is your walk. I'm making fun, but this is what it is. Okay, you're starting off here. As you're walking, this is going like this. Like this. That right is stuck. It wants to ride up high. Keep going, please. Keep going. You can see it just keeps wanting to shift up on the right. But here's what's interesting. With that being stuck, your right foot arches better than your left. Your left foot externally rotates and then it pronates in. You're a left shooter or right shooter?
Left, predominantly.
Oh, okay. So right is your posting leg, right? You
Yeah.
post with your right.
Yeah.
You've had some good ankle sprains, yeah?
Yeah.
Yeah. We're probably going to need to work on that as well. Whatever we find, we'll work on, okay? Now, watch here. Walk on your toes. Let's see if anything changes in the mechanics here. Walk on your toes, please. So what's interesting, when you walk on your toes, it looks better.
Oh, really?
Interesting.
Keep
Walk
going.
on your heels. Now you see the shift. L4. So walking on your heels, L4, L5. Walking on your toes, L5, S1. Walking on your toes, back looks better than walking on your heels.
Huh.
I see a nice shift at that L4. Okay. Now let's march in place. So you can see it goes down this way, down this way. He's very rigid through here. Okay, very stiff. What are you doing right now for activity? You at least getting your walks in?
Yeah. I started walking and just doing the rehab and like more core.
So you see every time he steps down on the left, his whole body wants to go to that side, and then when he steps right, it's shifting out lateral this way. Watch his feet. Now, I want you to close your eyes. I'm right here. Close your eyes, keep marching. Let's see what changes. As soon as you close your eyes, we're activating that upper cervical mechanism. And you can see as he's kind of starting to walk away. So there's two components. Open your eyes, see where you're at.
Yeah.
So there's two components. There's an upper cervical component, there's a foundation component. Now, foundation could be sacrum or pelvis. L4 is an issue. Are we symmetrical left to right side? Does this hole look the same as this hole?
No.
Slightly off a little bit,
Yeah.
right? Let's look at the hip sockets. Do the hip sockets look the same? This whitening you see on both sides, right?
Yeah.
The whitening, it's called enuberation. It just means that that bone is thickened based on the forces applied to it. Wolff's law. Bone will grow according to the demand placed on it. But if we look a little closer, this looks a little more symmetrical. This looks a little jaggedy on the white part, right?
Yeah.
But then it also, here, it seems like there's a little more space here than there is on the left side to me.
Yeah, I see.
Do you see that?
Yeah.
Okay. Now, let's look at we know good positioning. People often ask, how do you know the positioning of the x-ray is correct? This is the lesser trochanter. This is part of the femur bone. And when we're looking at it, they should be symmetrical. That means your positioning was correct. So we should see a smooth, symmetrical joint space. We can see it through there, right?
Mm-hmm.
What about here?
Fades away.
Fades away, little scar tissue or something's a little, it's like, it's crunchier, so to speak, grindier.
Yeah.
Let's look at your tailbone, and this is really important. You're 18.
Yeah.
Okay, here's the good news about that. The sacrum doesn't ossify or completely form until about 32, 33.
Mm-hmm.
And I'm saying it because it's important in your case. I want you to see this. You can see the bend in your sacrum.
Yeah.
Do you see that?
Yeah, you can.
Okay, so that thing is kind of talking to me right there, that bone right there, and then it does this. It goes this, and then it's a kink right there. This is L5, S1, S2, S3, S3 or S4. Okay, there's a good kink. And look, this is what I want you to see. Let's zoom out a little bit. It's kinking like this, and then it comes to this side. And then your L5, the L5 goes with it, right?
Yeah.
It's higher on this side, and then what does L4 do?
It goes
Compensate.
back, yeah.
Okay, but now let's look at here. You see that nub right there?
Mm-hmm.
Okay, this should be a smooth arc. And one was that lucency we saw, we were down here in the coccyx, but more importantly, we have these two nubs and a little bit here. You had some good falls. I mean, you play hard. I'm not telling you to stop.
Yeah.
I'm just pointing this out for you because this is probably where we're going to start.
Okay.
Around the sacrum. So we know there's something going on in the sacrum. We can see L5 starts to tilt on that side going with it. L4 does what? Comes back to level, right?
Mm-hmm.
But the crazy part, when you look on the side, L4 looks like the bad one. L4 is the compensation. You see this here?
Yeah.
It almost looks like the body's trying to calcify this area. You have a lot of instability in this part of the body. That's 5, 4, 3, 2. L2, L3. What did they tell you?
L2, L3.
L2, L3 is not the problem. L2, L3 is a compensation. So you're starting to get calcification here. You're 18, you're starting to get a hook. The body's trying to stabilize. And I want to talk about, do they do an MRI?
Yes.
Okay, let's talk about an MRI real quick. It's kind of important. All right, so you were told L2, L3 based on an MRI. You were lying down for the MRI.
Yes.
Okay, here's the issue I'm having with a lot of MRIs. MRIs are fantastic for soft tissue, for trauma, for any serious things, fractures, or do CT. But when we're evaluating the disc is in the spine. The spine is a weight-bearing structure. And the way I was taught is whenever we're imaging a weight-bearing structure, we should always image it weight-bearing. Now why? Spine, synchronous, contiguous, 24 bones. Everything works together. Now, they've already quantified the movement in the spine. What do I mean? There's a book, it's called Clinical Biomechanics of the Spine, is what we trained in. Studying the mechanics, the authors were white and Punjabi. They're the authorities on biomechanics. Okay. There's a concept in there we talk about is global motion and intersegmental motion, which means what? Intersegmental motion is each bone will move a certain amount. We know that the lumbar spine, each bone moves a certain amount in flexion, extension, side bending, and rotation, and all the way up. Now, if I say, go ahead and just touch your toes, bend forward, that's global motion of the entire spine. Each bone has to make up that motion, right? So intersegmentally is motion, creating a global motion. Okay. Now, let's say one segment is stuck.
Yeah.
2, 3, 4 segments become hypermobile. They move more to compensate to create the same movement, global movement. I put that person on the back, the stuck joint don't move.
Yeah.
The hypermobile segment moves. And it appears as a false positive. It is very common. I'm just discussing mechanics. Okay, so when I'm talking about, now, we do use an MRI facility local, it's seated, it's weight bearing.
Yeah.
There's not a lot out there. So there is something at L2, L3, but it looks like there's calcification going on there due to instability down low. Okay, sir?
Yep.
Can I continue?
Yep. Keep going.
Cool. 5, 4, 3, 2, 1, 12, 11, 10, 9. These discs are all good, but you can see all this stuff happening. You can see concavities on the sides of the vertebrae. It just tells me you play hard. Okay? We will need to talk about your digestion later as well. Your digestion's off. I know it is. How do I know it is? 2 reasons. Number 1, this air bubble, and especially for your age, this should be a big half black circle called the Meganblasi. Number 1. Number 2 is when we look over here, you have a lot of gas and undigested food on the right side of the colon, which is the ascending colon. That's where we absorb and assimilate. So by the time it comes across transverse in here, it's not coming through absorbed. So you're not getting the value out of the food that you're eating. Hopefully that's going to change in a couple of visits with us here, okay? I'm just pointing that stuff out. I know you're not here for that, but it's important. And then what are we going? This is what's interesting. You've watched videos of me talking about neurological control of digestion around T6, T5, 6, 7 area? Okay. That's 1, that's 2, that's 3, that's 4, that's 5, that's 6. That's your kink. This is digestion. This is heart and lung. This is breathing and circulation. I'm sure you get some exertional issues as well.
Yeah.
You didn't tell me this, did you?
I did not.
Okay.
Way to put me out there like that. Appreciate it. Put me on blast like that.
Why?
No, it's good.
All right.
Like, tell me. Yeah.
All right, I'll tell you. So you see this, right? And then from here, what happens? Right at the neck level, here we start to, the tilting is fine, your atlas is fine, but your jaw is off. You got stuck good in the jaw too.
Jaw?
Yeah, TMJ, right side, boom. You got stuck there, good.
Oh, okay. I got hit in the nose too at the same time, I think.
Septum.
Yeah.
Okay.
Is my nose off?
A little bit, but it's not so bad. Well, that's not a primary.
No.
We'll deal with that, all that. But the jaw is
That's the
something we'll
least.
deal with down the road as well. Okay, because the right one goes that way, the left one compensates. And it'll be important down the road. Okay, we want to deal with that. Make sense?
Yeah.
All right, side profile. You carry your upper body behind your foundation. So what are those muscles up top doing?
Trying to pull it back.
It's working off balance.
Yeah.
So you're twisting, striking, you're not getting full power. I already know why.
Yeah.
Another piece of knowledge I want to share with you. Locomotion in the spine. Where, the power, the motor, where does that come from? And most people don't know this. It's really cool information. So I say, where's the locomotive power? In your car, you have an engine that spins.
Yeah.
Where is it in the body?
And your structure.
Okay. Where?
The sacrum, hips.
So pretty good, not bad. Locomotion comes from lateral bending of the lumbar spine. So this is the movement pattern. It's called a coupled pattern.
Yeah.
You bend, side bend or lateral bend lumbar spine, ipsilateral coupled motion rotation. So the power locomotion comes from this. Bend, forward, bend, forward, bend. This is our locomotion, okay? And as we're going through this locomotion this way, that's how we get our power. Now think about it. If the spine is stuck and you don't get to bend one way versus the other, what do you think is going to happen? You're either going to have a short leg, short strike, or uneven power. Make sense?
Yeah.
Here's another answer, okay? You have this little stair-stepping effect. So if you look at the back of 5, it's slightly behind sacrum. If you look at 4, slightly behind 5. If you look at 3, slightly behind 2.
Yeah.
If you look at 1, it's we call that the stair-stepping effect. The answer is not here. If there's a stair step and each segment above is posterior to the one below and it continues, we have to do what? We have to go down low. This is extension. They should all be moving back. This is flexion. Which one didn't move forward? This one. You see these two didn't move forward. These all move forward.
Yeah.
So the culprit is probably down here for the fix. And the first thing we're getting is 10 points, C6. 9 points, T6. Left side. There it is. Watch this. It looks like it's up there. It's 15 points, S3, S4. Yes, sir. It's very distinct right there. Open and close the knees. Open and close. Open wide, close. Left side only. Not too bad. Right side only. Left pelvis is fine. Right, do the left side again. There's a tiny bit there, but we're going to start on the sacrum and I'll tell you why, okay? Scoot back for me, please. So in the Gonstead work, when we have a rotated sacrum, ASIN, a rotated sacrum with an ASIN on the same side, the book and the mechanics tells us do the sacrum first, okay? So that's where we're going to start. Come back slowly towards me. Okay, that's your L5, sir. That's your L4. That's your L3. Okay, that's the L2. Tender?
Yeah.
That's tender, right?
Yeah.
Okay. Let's go back down here. Tender?
Yeah.
That's L5. Let's go lower. S1.
Yeah.
Let's go one more. S2. Let's go one more. That's the one right there. On the more tender on the left side, right there.
Yeah.
More tender on the right. No.
Left
side.
Feel that in my leg. Left side.
That went down your leg when I did that?
I felt it, yeah.
Let's do that one more time. S3, left side. Yes?
Yeah.
Starting at 7.
Yeah.
7, S3. Let's check the neck. All the way back. Good. 7, 6, 6, 6. Okay, so C6, T6, S3. S1, 2, 3. Now, there was a slight, one second. Yeah, slight short leg on the left, very slight. Why I'm saying that is I'm going to torque the sacrum this way, clockwise, just to get a little lift for you, okay?
Okay.
Home run. Gotcha. That was it, sir.
That was crazy.
Now, let's do 1, 2, 3, 6, 7. Number 7. Gotcha. Come off the table, please. Hold my hand. And let's walk a straight line back and forth. And the first question I'm going to ask you is, what was different about that adjustment for you? You've had adjustments before.
Yeah. I don't think it's never been that low, first of all.
Okay?
And as deep as it was, I felt it like, I felt like you broke like layers, like you went deep inside.
I set layers. I didn't break any.
Yeah, never mind. You didn't break it.
Now, as you're walking, check it out. Got a little more movement going on. Knees up high when you walk, please. Knees up higher. There you go. Regular walking now. Tell me what's different in your walk right now as you're walking.
I feel more loose for sure on my tailbone, like my hips kind of too.
Okay. I want to really show the contact for C6 and the lift of C6. So the contact is the distal palmar surface of the index finger. Flex the patient's head forward, and you want to get right underneath there like this and hook C6. And the reason, part of the thing with the cervical is you want to lift it. You want to lift it, right? It's like turning on the light switch, and it's very subtle. So it's not just jab it like this, okay? I wasn't trying to jab it, by the way. It's come underneath it and lift up, look up, and set up. So you're lifting it up. How's that?
Good, yeah.
Nice. Walk it off, please. That's a set, okay?
I like I'm moving more in sync, kind of more straight.
Have a seat over here. Let's rescope and let's feel that L2. 6 is clear. So C6 was clear. T7 is clear. Now we'll probably get a little muscle activity going on because things have been out of balance for a while. Nope, clear. Now let's feel. Back towards me. S1. S2. That's the one. Anything shooting down the lid? No. S3. Now let's go back up. 5. 4. Different?
Yeah.
Let's go up to 3. 3. Different?
Yes.
Here's your culprit, you said. How's 2?
Don't feel anything.
Seriously?
Yeah.
Do you see that now?
Yeah.
Okay. All clear, sir.
I was gonna ask one more thing about this toe.
What about it?
I've broken it or fractured it like 2 times,
Okay.
and so at the end of like this one I can bend the end of it, like,
Yeah.
but like, I can't bend this one. It's like the sharpest pain if I even bend like
How
the end
long?
a little bit.
How many years?
4 years. Anytime I go to the doctor, I always have to tell him, please don't touch that toe.
Okay, let's see. So you're telling me about the toe, right?
Yeah.
Tender there.
Yeah.
So you can't bend it, you said it's stuck, right?
Yeah.
Okay. Come check this out. Let's see what we can do. Let's look at his big toes. So we can bend this, all good.
Yeah.
Not a lot of, it's bending up here, but there's no bend here.
Yeah.
Whenever we're working on the feet, 26, 28 bones in the foot, 6 major misalignments that occur with a sprained ankle. 85% of all foot problems we deal with starts with a talus misalignment. So while you broke this, you don't think you twisted this? You did.
Right.
So we're gonna work on your ankle, okay? Now between the two, I'm gonna work on your right ankle today, more importantly.
Yeah.
I'm gonna start with some lotion. We need to break up some scar tissue and swelling, okay? And you take it as much as you can. If you can't deal with it, you let me know. All right. Now, we're just working all the periarticular swelling and scar tissue back in. You feel what I'm doing here?
Yeah.
If anything is too sharp, like I said, please let me know. Oh yeah. So, the idea with this is break up scar tissue, equalize some of that pressure, work that swelling back. There. 5, 4, 3, 2, 1. Now, passive range of motion. Are you okay with me doing this?
Yeah.
What's interesting, I'm on your big toe too, right?
Yeah.
You're okay with this?
Yeah.
Okay. Talus. Tender?
Yeah.
Yeah. Talus. AS talus, medial tilt, posterior fib, and inferior navicular. Those are the 3 we're going to start with. There you go. Gotcha. Nice. AS talus, a little more. Posterior fib. Turn to your right side. Check it out. Watch this. Navicular. Bend the toe.
What the heck?
Check it out.
What the?
Go on your back.
I haven't been able to do that. Years.
Wow, right? Yeah. Look. Wow. We're getting some bend. You're able to do that, right?
Yeah.
It's not killing you, right?
No.
Cool. Dropped 4th. That's fine. Stand up and walk on it now, dude. And tell us what's different. See how that foot is. The bonus bunion.
Yeah, wow. Way more stable. I feel like I'm using all of my foot to...
Walk on your toes now, check it out. Now if you watch his feet, he actually has a bend in his big toe. Right?
Yeah.
Check this out, walk on your heels, should be more stable. Because you can actually bend that toe just a tiny bit.
Yeah.
Right? It's not fixated, you got a little bit of a bend in there.
Mm-hmm.
Open all the way, open, open, open. Yeah, that's what I was talking about. You can see the deviation there. You feel that?
Mm-hmm.
Close, slowly open. Right side. Okay. Let's start working on that. Open all the way. Open, open, open. Slowly close. There. Okay. Now, your homework with me is simple. You've heard me talk about it. Water, walking, ice. That's it. No weights, no resistance bands, walking, biking, swimming. There's no gym right now, so hiking would be great. Welcome to the office.
Thank you so much.
You've been with me a minute, Ethan.
Yes, I have.
What you been up to?
Healing, getting better, learning.
It's been over a year.
Yeah.
Started before pandemic.
Mm-hmm. Yeah.
You're a soccer player,
Mhm.
right? College student.
Mhm.
All good. Had a few injuries.
Yeah.
Couldn't play
For a while.
for a while. You were told surgery,
Yeah.
and you were 19 when you started.
Yeah. 19.
And surgery for your back. That's what
My
you're
back.
telling me.
Yeah.
Because you had a slipped disc.
Mm-hmm.
And we adjusted you, I mean, it wasn't 3 times a week.
Mm-hmm.
It was a few visits, though, in
Yeah.
the beginning.
Mhm.
Now you're coming for what? Maintenance? Tune-ups?
Tune-ups, exactly.
Tune-ups. Okay. Where are you at now?
Just, I mean, like we use the word maintenance, but just trying to like stay healthy, really.
Okay.
I don't like. Obviously, you don't want to go back to like anywhere near where you were. So just like making sure all my muscles are like strong enough, and I'm correcting things that were not like correct.
That's what you're doing, because I'm not doing any muscle work for you.
No, it's just
What am I doing for you, really, at the end of the day? Real simple. What do I do for you?
adjusting.
I make sure your spine's clear, right?
Yeah.
That's it. Really, if you think about it.
Yeah.
What am I really doing for everybody?
Mhm.
Checking the nervous system, making sure everything is clear, giving them some answers as to where those nerve pressures are.
Yeah.
So the job here is to come get checked. Am I clear? You got a symptom? Is something out? Am I clear? Does that sound about right?
Yep.
Okay. And then your job is to do what? Everything else.
Yeah. Everything else. Keep
Right.
it that way.
Keep it that way. All right, I'll put your films up there. We'll let's examine you and see what's going on. What's new? Anything new going on body-wise?
When my left
Talk to us.
pelvis was raised.
Okay.
It was from like I think it was from a lot of like repetition of shooting in like this position because I'm left-footed. So when I
Okay.
shoot,
Your left pelvis was actually dropped, dude. It was lower.
Okay.
Okay.
In this position, like when I shoot, I can sometimes feel it in that area. Like
On the
recently-
left side.
Yeah, on the left.
Okay.
That's like what's new, probably the only thing. that
Okay. So in your initial exam and X-ray, your left pelvis, it was your right pelvis that was up.
Mhm.
Your left pelvis was slightly down, and there was a slightly short leg. So we have a PIEX left pelvis. We had a rotated sacrum on the right, and what we were doing was, if we were focusing first on your sacrum. Remember your tailbone?
Yeah.
I think
That
we
was
have a video of you way back when.
Yeah.
And then when we were getting to the pelvis, the left pelvis we're putting up. Now, let's talk about that. If the left pelvis is down, so left pelvis, it's PIEX, opened up.
Mhm.
Now, that's your shooting leg, you said, right?
Yeah.
All right. So you have a PIEX on the left. It's down.
Okay.
If it's down and you're trying to shoot, it can't go down further, so it's harder to raise it up.
Yeah.
Does that sound about right?
Yeah. Okay.
Okay, if it's down, then there's not more of it to go down.
Mm-hmm.
So pelvis seems like it's been acting up.
Yeah.
Is that what you're telling me?
Yeah.
Okay, so we'll take a look at it. Conversely, if the pelvis was up,
Mhm.
it would be harder to bring the leg back.
Oh, okay.
Okay?
Yeah, it's
So
for
we
sure
have-
harder to bring it.
It's harder to kick.
Yeah.
And that's your shooting leg.
Yeah. Okay, have a seat. Let's take a look.
Starting at the base of the neck, let's see what we got with Ethan here. We got a little bit up top, 15 pointer, top left. That's causing actually a bit of core pressure. And that's going down all the way to the left. You have up in the penthouse, down in the basement. Is this your normal sitting, or are you trying to sit like this?
No, this is pretty normal.
This is normal now?
Yeah.
Right on, dude. So it looked like it was breaking at around L2, L3, but it continued on down to left SI joint. Left SI and up in the penthouse, atlas, occiput up top. Feet together, I'm on the medial aspect of the PSIS. Open and close the legs. We're checking general motion of the sacroiliac joints. Do the left side only, please. When he does the left, there's a little bit of movement of that right side, but it's tighter more here. It's more tight up top in the erectors and the muscles up top there. Do the right side only. Now, here's what's interesting. The right muscles are tighter here. But when he does the right side, the whole left is shifting because it's stuck at the SI joint. The right side was shifting. Do the left side only. The right side shifts because the whole muscle is tight. But the left side is shifting because of the fixation of the joint. That's the difference.
Okay.
Okay? Now, let's check top of the joint, middle of the joint, bottom of the joint. So with a PIEX, it's going to be a little bit tighter at the top there. Okay? Which it is. Middle of the joint, that's okay. Bottom of the joint. Okay to you too?
Yeah.
Yeah. Right side, left side. You feel that there?
Yeah.
Turn left, turn right. It's a little tighter going to the right. Now let's do a divorce test. Head down, isolating the upper cervical. Left side's okay. Tighter on the right.
Yeah.
Look up at the ceiling. Turn left, turn right. Tight there too though, right?
Yeah.
So pressure I'm getting is left atlas, but it's right rotation. So let me take a look at the upper cervical and see what we got. So here's what's interesting here. So on the left, if we look here, C2 is actually wedged a little bit. C2 is here. C2 is actually wedged a little bit. It's tight on the right side. The swelling is on the left. But it's C2 because it seems like the ligament is tight between C1 and C2 on the right side. Here, let me show you on the model. So here's the model, okay? So the pressure we got was here, okay?
Yeah.
But when I'm looking at it, it's actually C2. This one that's off like this, okay? The atlas between C1 and C2 here, the disc, I'm talking about the capsule right here. We've got two capsules, two articular capsules. There should be a space. Let me do it here. There should be a space in between C1 and C2. Your space is there in C1. In C2, it's almost like there's a little bit of binding of the ligament. Come here, look. Mira. You see the space? There's a lucency all the way through C1 on the right. Sorry, on the left. But on the right, it's not.
Oh, okay.
So I'm actually going to set your C2, not your C1 today.
Okay.
Have a seat over here. The reason I'm saying that is if I set your C1, here's another way to look at it. This is C1, this is C2. C1 is slightly to the side. I don't want to push it more. I want to bring C2 underneath it.
Oh,
Okay? That's the difference. So for C2, we're going to hook. It's got the big bifid, big spinous. Bifid means there's two pieces of it. Feet straight, please, Ethan. Good. And we want to get right on it. Like that. Like that. Home run, baby. Nice. Butter, baby. All right. PIEX. PSIS, posterior superior iliac spine. We're going to be on the lateral, inferior lateral portion. We're hooking it with the pisiform. We're pushing it P to A this way, and there's a torque, and the torque is coming through the wrist. Okay, I do like to stabilize it this way. You don't have to do it this way. It's just like that. No twisting, right?
Yeah.
Walk it out. So one of the things I like with Ethan, he got hops too. You gotta do some hops for me. You got some hops for me today?
Yeah.
Let's do some hops. Let's see.
Right now?
Yeah, let's do some hops. All the way up. Okay?
Yeah.
Put down. Hop up one more time. Nice. And down.
Feels good.
Feels good?
Yeah.
And down. Have a seat, please. Let's rescope you. Starting at the base. Clear. All clear, Bubba. Now, people ask about the post scope, and I've had people ask me comments about, hey, I went to a Gonstead doctor, he didn't post scope. It's not typically taught.
Oh, really?
Okay, post scoping is typically done in the upper cervical, maybe, but a lot of offices they don't post scope. My mentor post scope, I post scope. Okay, and the way he taught me was, you're looking for a neurological change, Rahim. So it should either be reduced, 0, or go to the opposite side. If you haven't done that, then you haven't made a neurological change, you just made it crack.
Wow.
That's why I post scope, by the way, okay?
Yeah.
Scoot forward. I don't think I ever told you that, did I?
No, never.
Feet together, open and close the knees. Open and close. Right side only. Better. Good. Left side. Different.
Yeah. Easier.
Easier. Try do some, you want to do some kicks and make sure?
Yeah.
Let's see.
Just like the motion?
Whatever your motion is, do it.
You lift it way higher already, just.
Keep going.
Yeah.
You tell me.
Yeah. 100%.
All right. Good.
Way smoother too.
Have a seat. Yes, talus, we do a tilt up. There you go. Squeeze. Squeeze. They're like, what is he doing? I'm checking the bones, okay? It's a little bonus that I do for everybody. So when you're squeezing the hand, I'm checking the carpal bones. You have 10 carpal bones here. I'm checking to make sure everything is seated correctly. Checking the joint, the elbow joint on both sides. Squeeze. Squeeze. A little bit only on the inside. There you go. A little crunchy. Lunate. There you go. Squeeze. 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 A little bit. Turn this way a little bit. This way. A little bit on the scapula. There. Crunchy. Squeeze. We're all set for today. Welcome back, Ethan.
Thank you.
It's been a minute, right?
Yeah, it's been a while.
So I wanted to share a little bit with Ethan. Ethan started with me a few years back.
A while back, yeah.
A while back, right?
Yeah.
Actually, a few years.
Like 3-4 years
3 or
now
4
at this
years
point.
ago. And Ethan plays soccer. He's got some skills. Okay? One thing I wanted to share about Ethan, I actually learned a lot with your case, jokes aside. And I learned a lot about soccer injuries because he's a competitive soccer player. And he would have these, first it was getting rid of this pinch nerve.
Right.
And we fixed that up for
Yeah.
him, right?
Yeah.
But then it was like you're playing soccer and you're practicing and you're getting injuries.
Right.
And then you're not able to practice, you're not able to work out, and you're going through this cycle up and down.
Exactly, yeah.
And then, but the cool part was I started watching him and watching, you know, how soccer players move, how they kick, you know, and learning about the different types of kicks. And through that, learned on how to fix these soccer injuries. That was actually really cool. And then I had some big soccer player come in after that, and I was able, he had the same thing you had.
Yeah.
And I didn't actually, you know, it was a pretty big guy. And they won a championship.
Yeah,
which
big
is kind of
one.
cool. They won a big championship. But jokes aside, I learned how to help that guy through Ethan. So thank you.
Oh, thank you.
Seriously, no, it was a
cool.
great learning experience,
You got to
and
use it.
I got to use that knowledge, and learning the mechanics. I think every sport has different mechanics of the
Yeah,
body, right?
For sure. Yeah.
So even the way you guys practice.
Yeah.
Okay, so why are you here today?
Tune-up.
Tune-up time?
Tune-up, yeah.
So nothing specific, or is there something specific?
No,
to it?
nothing specific.
So-
Just the ankle probably is like what we've been working on.
Okay.
Most recently, but
And we had a sprained ankle,
yeah,
Yeah.
sprained ankle.
and we were able to help with that as well.
Mm-hmm. Yeah.
And the good thing that Ethan learned being here is the sooner that we get to the sprained ankle,
Yeah.
the faster it
100%.
heals,
Yeah.
right?
If you wait on it, it's just you can't get the swelling out, and then you don't adjust the joint, and I feel like it gets a lot worse if you don't.
And you've had sprained ankles before.
Yeah, that healed a lot slower
Right.
if you don't come in and get adjusted, I think.
Well, yes. So one of my mentors, who was the Gonstead extremity specialist, he taught us the golden hour. And if we can get to that injury in the first hour, and as long as there's no goose egg deformity, there's no vascular, there's nothing
Yeah.
severed, there's no blood compromise, then the faster we can get to that, the faster, 50% healing. And even with a sprained ankle or any extremity injury in soccer or any sport, I always think, because the way I was trained and taught is spine first, right?
Mm-hmm.
And the question is, why spine first? And the reason why is we got to make sure, like if you sprain an ankle, you twisted it, but it's all connected,
Yeah.
right? And 9 times out of 10, when they sprain an ankle or a knee or something, or shoulder, elbow, wrist, like falling on an outstretched hand,
Right.
and the shoulder hurts. And so, again, it doesn't make, to me, it's get the power on first, then follow kinetic chain. Get the power on first, then follow kinetic chain. Makes sense, right?
100%.
Okay, you ready to get started?
Let's do it.
Let's do it. All right, how did you do with our last adjustment, last visit?
Good. That was the fastest I've ever healed from an ankle roll like that.
So you came, how long after you sprained the ankle?
I think we waited 5 days because of the swelling. 5 days, it was less than a week, I'm pretty sure.
You were back practicing?
I was jumping and running,
Sweet.
it was crazy.
C2, mid-back is clear. So good news, your spine is clear down low. We're going to check the hip. We know we need to work on the hip. And C2, those are your 2 spots, and then we're going to deal with the ankle. Feet together, open and close the knees. Right side only. When he does the right, there's a slight shift of the left. Left side only. Kind of both. Let's feel it this way. They're both a little bit stuck. Put a little more curve in the back, please. There you go. Come back towards me. Top of the joint, middle of the joint. We're at the SI joint and the bottom of the joint. Not too bad, right?
No.
Top of the joint, middle. That's it. That's not moving right there.
Yeah.
Right SI joint is an ASI and ilium, and let's check C2 up top. Sit back here for me, please. Sweet. Now, what's interesting on his x-ray, we are working on his pelvis because there is the ASIN on the right. There is a dropped femur, which we're dealing with. It is getting better. We'll probably take a new film end of the year or something to see where it's at. We don't need to deal with that right now. And C2, if his curve, you still have a little bit of that reverse curve.
Mm-hmm.
And we typically don't adjust into a reverse curve. The exception is C2, or if there's a open wedge on the AP film. Right there. Bend to the left.
Oh.
Bend to the right. I'm pushing even harder on the right. So C2, right pelvis, then we deal with the ankle. Sound good?
Sounds great.
Okay, let's do C2 first. And see how he's kind of sitting, relaxed, palms up, resting on the thighs. You can bring your knees slightly closer together and on your heels. This is your ideal. Dr. Gonstead found this to be the most relaxing position for the cervical adjustment. C2. Oh, that's the home. Walk it up. You like?
That's the one that makes you feel like you just woke up again. Gotta do that a couple times.
Nice. Walk one more time, please. Good morning.
Russian blood.
Left side down. And for the ASIN ilium, from the PSIS, roll a little bit forward, please. From the PSIS, the dimple, you're going 2 inches lateral, 3 inches inferior. That's the Gonstead spot. Look, it's already gone. Now, let's roll him slowly. And the set is going to be down the shaft of the femur and slight counterclockwise torque. Just like that, Rahim. Walk it up one more time. Don't ficar.
Yeah, that wasn't a crack.
What was
a
it?
set. That was a set.
Nice.
Ooh. That feels different.
Walk one more time, please.
Okay.
Okay, let's go on your back and let's check out the ankle. Feet together. Bring the toes back as far as you can.
Even?
Which one did you sprain again?
This one?
Dude, look. Bring them back. Your left actually goes further back than your... I got to work on your right one today. That's actually pretty cool. We're going to work on that, but we're going to also set your right one.
Doesn't feel great, but see those people sometimes
Making the noise. I mean, I go to their tolerance, right? And I know it's not comfortable. People have different pain thresholds.
Yeah, that's not that bad.
There you go. Okay, let's set it. Ready?
Yep.
Go. AS talus, medial tilt. And the right side. We'll do the board. Most of it's gone, dude.
Yeah. Oh.
I told you it was the right one that was
Yeah,
actually
what
up.
the heck? That one fell on 5 or more, but...
Slide up, raise your left leg.
Definitely had less motion, like you said, like range, I think. The right one?
I think you were compensating a little bit on it since
Yeah.
that was off a little. Now let's recheck. Feet together, bring them back. There you go. Sit up and turn. C2 is clear. Still clear. Go. Over, around, down.
Oh,
Sorry.
no, I got it.
There you go. Ears.
If you're thinking about coming, do it.
Oh, dude, we're not plugging it.
Oh,
There you go. Squeeze. The take-home message, really, right? Like I said, I learned a lot through working with you, but also is you get it now. Whether you're in pain or not, you know you're a competitive soccer player,
Right.
and you know things. You may not have pain,
Yeah.
but things get out of balance.
Yeah.
And the idea is to get back in balance,
Yeah.
right?
Before many things compensate, I feel like, you know?
Prevention.
If you wait, yeah.
Prevention. It
Just more
takes
stuff.
longer when you're hurting.
Yeah, more stuff gets out of whack.
Yeah. All right, brother.
Thank you so much.
Appreciate it. Okay. The nerves that come out of the neck are the ones that control the chest and the arms. All of this is powered by the nerves here.
Okay.
That's why I wanted to know if there was he getting weaker towards the end or not.
I think
Was-
I'm just more tired.
Just tired. Okay. No pain in the hands or arms.
No, there's no pain.
Nothing in the back. Everything is here on the sides of the neck.
Yeah.
Right. Both
Down
sides
the
of the
shoulder.
Okay, got it. This is typical when we were kids, even when we were kids,
Yeah.
right? We play, we slip, we fall. It hurts. Yeah, okay, it's sore. It'll go away. That's how we were raised.
Exactly. So,
but there's a difference now, and there's a big difference, because what happens is we all have slips, falls, we play sports, we do these things. Most of the time it's going back in place. In this scenario, maybe it didn't. That's what we're going to check, okay? And it's important, because when the kids are we're telling our parents, it hurts, it really hurts. It's like, just ice it, take some ibuprofen. And then what happens is, I see this stuff 20 years later, that the mechanics that were altered back then affect them later on down the road. So it's a good thing you're here. Let's get him checked out. So his pelvis is completely off. Look at this. This is the dimple here. Feel. Put your fingers here. Put your finger on top of mine. That's the pelvis there and there.
okay.
Okay? Now, sit up straighter. So this whole thing is puffy. Do you see that?
Right.
It's not supposed to be like that.
Okay.
So this is actually starting as a sacrum, a tailbone issue. I'm going to show you on the meter. I'm going to get here, don't worry. But I examine the whole spine to see what's going on. And remember, things down low can affect above and vice versa. You got 7 bones in the neck, cervical, cervical, C1, 7, 12 in the mid-back, thoracics, 5 in the low back lumbars, and then you got the sacrum.
Okay.
Sacrum is consisting of 5 tubercles that fuse in our 30s.
Okay.
So there are individual bones here. What I want us to check also is his pelvis, because the dimples are off. This dimple is low, this dimple is high. This butt is smaller, the cheek, than this side, because the pelvis is also off. This stuff, he's an active kid. He's not feeling it, he's running through it. But he's going to tell you after the adjustment what's different. So this is the foundation of the building, right?
Correct.
The foundation is not level. What happens to the rest of the building is compensating.
Right.
So the pelvis is high on this side, okay? Now he's compensating by raising the left shoulder. Look. This all compensation because of the right pelvis. So just on the visual, something doesn't look right here around C6. C7 is probably going to be his VP. And yep, there it is. Dead. Goes to the hot nerve, comes back. And it's interesting how it happened to be right where that kink is. And if I don't do his pelvis, his low back, that's not going to hold, by the way. This is normal, but he's fighting, right? To sit like this.
Yeah.
Yeah. Okay, feet are touching, open and close your knees. Open wide, close. Open, close. Left side only. The right wants to go with it. Right side only. Left is fine. This is a right pelvis issue. Is it tender when I push in here?
Yeah.
Yeah. Is it also tender when I push in there?
Yeah.
Okay, so he's got sacrum and pelvis. Let's go ahead and do a Gonstead leg check, and we'll figure out where we're going to start. So the idea is right side is short. Do you see that?
Right. Okay.
Now we're going to bend 90 degrees. If it stays short, we're doing sacrum. If it goes even or long, we're doing the pelvis today.
Okay.
Okay? Now, stays short. So we're going to start on the sacrum today. He's already guarding there. That's 6. Bend right. That's 6. Bend left. Doesn't want to do it, does it? More pain that way?
Yeah.
Or that way?
To the right.
More pain when I go to the right?
Yeah.
And you feel the pull, right?
Yeah.
Now what happens when I go to the left? Do you feel pain here or a pull here?
Feel a pull right here.
So it's more of a pull on both sides.
Yeah.
So the muscle is guarding that area for C6. Okay. Nice. You ready there? Almost.
Ah.
Gotcha. That's it. That's it. You okay there, Max?
Yeah.
That was the worst of it, dude. All the way back. That should feel better.
Yeah.
It felt good. That sound felt good.
Now, here's the good test, right? Bend left. Bend right. Thanks. Less pull.
Yeah.
Still tight, but it's less. Now, can you go to a happy place? If I drop you, I'll send you and the family to Hawaii. How's that? So don't try to fall, though, okay? Don't try to fall. I'm gonna do it as a push today. There. Home run! Ah! Awesome. Walk it off.
I feel like straight. Feel more straight.
Mm-hmm. Have a seat now. Let's see how he sits. It's already a little different.
Yeah.
Now, sit up straighter. That doesn't hurt as much, does it?
So this is the
The sacrum, the tailbone.
right. And once this is off, then the whole.
It throws everything
Yeah.
off. Absolutely. So this started here.
Okay.
Now, look at the shoulders. That's clear. You see that, Dad? You remember?
Mm-hmm. Mm-hmm.
It's clear. Home run, people. Tender in there. I know it's tender because I know you sprained that ankle before. I was saving this for last. There you go. Dad, help me with this. Come over here. Hold him like this. Face me. There you go. Hold it up. You give me your ankle. Let it go. There. Now you're going to pull slowly towards you. 1, 2, 3. That's it. Poquito más. That's it. Plus. That's it.
Yeah.
That's it.
Oh, that feels better.
Yeah.
It's looser.
Wow.
It feels like less tender.
Less tender on the ankle.
Yeah,
How's the back feel?
it feels better.
How's the neck feel?
Yeah, it feels less stiff.
Is it still stiff though?
No.
Squeeze my hand. Squeeze hard. Squeeze hard. Squeeze. Squeeze. Okay, let me set the elbow. Relax. And the thumb.
Whoa.
Let me set the elbow, thumb, and the wrist. Turn this way. This one's bonus.
Ah.
That's going to give you more balance, coordination, and listen to your dad and mom.
Exactly.